My name's Carrie Siegel, and I'm a professor of radiology at Washington University in St. Louis. I'm in the abdominal imaging section, and my area of interest is genitourinary radiology. For patients who have been diagnosed with testicular cancer, there will be a need for imaging studies. And that's going to be a twofold imaging study. The first study is going to be a testicular ultrasound. And the purpose of that is twofold. One, to look at the testicular tumor in the testes that is involved and to stage that testicular tumor, whether the tumor is confined to the testes, whether it's breached outside the testes, and there's a very firm vest or covering around the testes called the tunica albuginea, which helps keep the testes in sort of an ellipsoid shape. If the tumor is outside of the tunica albuginea, that's a higher stage. And then the tumor on ultrasound, we can look to see whether it's progressed up into the spermatic cord or the skin. The other reason why we want to do an ultrasound exam is to take a very close look at the other testicle. Because when a man has a testicular cancer in one testes, he is at risk of having a testicular cancer in the other testes. About 2% of men with seminomas will have a contralateral tumor in the other testes. And it's going to make an enormous difference in terms of management and sperm banking to know whether the other testis is tumor-free. So for that reason, we're going to do a thorough ultrasound exam of both the testes with the tumor in it and the testes without the tumor in it. After that, testicular cancer often has a landing zone deep in the abdomen around the aorta and the inferior vena cava. And the best way to image that is with a CT scan. So patients will usually get a CT scan. Sometimes it'll be a CT scan of the chest, abdomen, and pelvis, and sometimes it'll be a CT scan of the abdomen and pelvis. Often the patients, you will be drinking oral contrast, and even more often you'll get intravenous contrast to sort of help us with conspicuity so that we can see these areas better and look for small lymph nodes in the retroperitoneum. Occasionally other imaging tests will be involved, but those are rare, rarely a PET scan or rarely an MRI. We really only use MRI for problem solving when we're uncertain with a complicated mass in the testes. But for most patients, it's going to be a thorough ultrasound exam, both of the involved testes where there is tumor, and a very careful look at the other testes to make sure there's not tumor, and then a CT, either chest, abdomen, and pelvis, or a CT of the abdomen and pelvis, looking closely at the retroperitoneum, the area around the aorta and the inferior vena cava, for lymph node metastatic disease.